Thank you for the opportunity to participate in the International College of Person-Centered Medicine, Jim Appleyard Memorial 14th Geneva Conference on Person-Centered Medicine, Optimizing Clinical Care through Person-Centered Medicine. My name is Olga Castillo Costa, Master in Public Health, founder of the School of Nurses of the Universidad, Técnica de Loja, an advisor in Rosalía Arteaga, the Glocal Women Foundation. Indicators of quality person-centered care in general and in times of pandemic by professional groups. COVID-19 is challenging the world. Sudden changes in lifestyle violating the integrity of the person, provoking us to rethink and strengthen the health system and its operability, and at the same time, implement actions necessary to face problematic mental health issues. Considering mental health care is an essential service during the pandemic, Dr. Mesique proclaims in Conceptual Bases and International Implications for COVID-19. In addition to providing clinical care, psychosocial care is required within the framework of person-centered medicine, aimed at fully satisfying personal, family, and community needs. Considering the current state of health, he urgently suggests person-centered psychosocial care, a science as old as it is current. By the 1960s, Dr. Carlos Alberto Sigon stated in his San Marcos classes that psychiatry should be an essential science of medicine, and every doctor should include a bit of psychiatry aimed at caring for the patient as a person. What has been described leads us to reflect on and apply innovative tools in healthcare, prioritizing person-centered medicine and the application of quality indicators to efficiently respond to the challenges in times of great scientific and technological changes and great demand, and attend to the whole person, even more so with the presence of the pandemic, which aggravates health problems, and as the consequences of the pandemic deeply violate the way of life of the person, the family, and the community. Dr. Sagan, at that time, paid a lot of attention to the psychosocial support of the person, emphasizing that the true essence of medicine is not treating diseases, but sick people, objective, to analyze and contribute experiences of health professionals and to use quality indications of person-centered care in general and in times of pandemic. This is consistent with the historical aspiration to provide comprehensive health care to the person with a sufficient understanding of the true meaning of person-centered medicine. Methods. Review critical analysis of guidelines issued by the WHO, PAHO, MSP, and other documents related to healthcare. In addition, it was based on experience collected and analyzed information from health professionals during the last 2+ years of market changes in the world. The information was compared with the scientific literature of national and international organizations, and the results are relevant contributions in the field of health. Results. Health teams were strengthened by emphasizing the inclusions of cultural diversity to the scientific technical skills of medicine. Health professionals say during these last 2 years, although they were surprised by new situations, they were able to overcome the difficulties and learn very valuable lessons for professional practice. Person-centered medicine promotes a vision of professional cooperation between teams. New guidelines issued by the Ecuador Ministry of Health, MSP, in clinical care were applied and appear to meet the needs of care in times of pandemic. The application of person-centered medicine overcomes some shortcomings of the traditional medicine through contributions of experiences of medical professionals. Care protocols for patients with COVID-19 were developed and improved, including psychosocial care for the person and the family. At the local, national, and global levels, a deterioration of the health disease process of the person, their family, and the community was observed due to the pandemic. In some cases, according to nurses from Isidora Ayara Hospital in Loja, Ecuador, applying ethics and humanism achieves acceptance of the treatment by the patient and consequently adherence to it. The involvement of the family, overcoming the diagnosed problems, and optimizing clinical care. Problems are observed such as high mortality rate, traffic accidents, teenage pregnancies, domestic violence, suicides, and violent deaths, among others, that emerge from the imbalance of the integral context of the person. It is necessary to strengthen the health system with its comprehensive care processes, emphasizing socio-cultural support. Conclusions. The concepts and strategies of person-centered medicine were validated by the application of quality indicators for causality and the integrity of the person in public health. Nursing staff emphasize patient care by establishing bridges of effective communication with the patient and the family. Comprehensive professional training of person-centered medicine is considered mandatory by the governing entities of education and health, which promote the training of healthcare professionals to ensure that training faces current challenges globally, including application of indicators for healthcare, learning from experiences of those who've lived and worked in the midst of healthcare crises, which weakened the healthcare system in the last 2+ years. Achieving professional empowerment as indicators of quality in the care of the person and the family is mandatory. Emphasis is placed on the professional training of nurses with a humanistic, proactive, person-centered approach, promoting from the university classrooms the development of skills capable of assuming different roles that allow positive results driven by teamwork. The environment of effectivity in which the student performs is important so that future vision is in professional empowerment and satisfaction of performance as a nurse, including the promotion of health care centered on the person with a view to contributing to the development of a healthy and progressive person and society. Thanks to International College of Person-Centered Medicine, Jim Appleyard Memorial 14th Geneva Conference on Person-Centered Medicine, the International College of Person-Centered Medicine, and Rosalía Arteaga, the Glocal Women Foundation. We are a team of women supporting the development of women worldwide. We promote equality and respect in the representation and development of women of all ages in various settings: political, social, educational, economic, environmental, technological, sexual and reproductive health at the local, national, and international levels in safe and nonviolent settings. Thank you.